Hi, I'm Mary Wong, and I'm a registered traditional Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health, and author of the book Pathways to Pregnancy. I am your high performance and wellness coach, so welcome to my live post number 80. And today I am doing part 2 of why should you do acupuncture and how is it effective when it comes to fertility. And I'm doing this because last week I kind of skipped over it, not intentionally, but the post was getting too long, so I cut it off and I completely forgot. So here I am doing round 2. And so to reiterate, well, how effective is it? So the mechanisms behind acupuncture, there are 4, so I'm going to cover those. And so the possible effects of how it works with acupuncture, which is the putting in needles that are fine, disposable, sterilized, of course, and they're filiform needles that are surgical steel grade. And they're very thin, like as thin as your hair. And typically, if you're a well-seasoned acupuncturist, it should not hurt. Maybe a tiny little pinprick, barely. And typically people fall asleep, so it is very relaxing. So one of the things about possible mechanisms of acupuncture is that it reduces stress and it reduces depression. And unfortunately, as we go through fertility, it really increases our stress levels and often causes anxiety and depression. So it helps that. So that's awesome. And then the second thing is about producing endogenous opioids. So it's been suggested that acupuncture alters the secretion of these endogenous opioids, so these feel-good hormones, and especially which is beta endorphin. So there was one study with mice where they would immerse the ice, poor little mice or rats, into, I guess, an inch thick of ice water. So that causes stress. And so the control group were just immersed with this ice bath, so to speak, and the acupuncture group were given acupuncture prior to, and all they did was 2 points on their little knees. And what they found was that the stress hormones were much reduced in those that had acupuncture before they did the ice immersion, which is the stress factor, compared to the control group, which again did not have anything. So that's really telling, right? So that's kind of cool. And of course, as I mentioned, it can induce stress. So when you're stressed, you have your endorphins are really low and your stress hormones are high. So this helps to mitigate that. Now, I want to add though, so we know, and there's a couple of studies with regards to this, it influences the gonadotropins. So that can impact your hormones that are hypothalamus connecting to the pituitary, connecting to your gonads, your ovaries, and your uterus. And then we talk about altering blood flow. So increasing blood volume to your ovaries, uterus, reproductive organs as a whole. That's always a good thing because it brings in oxygenation, nutrients, and all that yummy stuff to make your eggs juicier, to make your uterine lining juicier. And then the last one is about modulating immune function. So this has more to do with improving outcome of IVF in terms of receptivity, especially because when you modulate cytokine production, so lowering this immune activator, it may help receptivity, because what you don't want is for your body to attack what they think is a foreign invader if it's an embryo. So you don't want that. So that's another theory. That's how it works. Now, there was a study by Dr. Paul Magarelli, who was awesome and did a joint presentation with me last Thursday, and where we spoke to the Canadian Fertility and Andrology Society. And so this is a nationwide, all the fertility doctors across Canada and their staff and their nurses and ethicists and lawyers and counselors, they belong to this. And what is missing for me is the complementary integrative medicine piece. So I'm creating a mandate to try to amalgamate and bridge the gap between Eastern and Western medicine. And so I had Dr. Magarelli from the US speak with me, and that was awesome. And he spoke about his study. So what was interesting was that, I talked about endorphins earlier, but what he found was when they took the blood levels, concentrations of hormones, they found elevated endorphin and prolactin levels. But he was like, I don't understand what's going on. So what he found was the fertile receptivity actually has a heightened cortisol level, which I thought was interesting. So when you have heightened cortisol, which is that stress hormone, at a specific time, it actually increases receptivity. Interesting, right? So point is, there are studies that say that acupuncture improves pregnancy rates. And certainly Lee Hollander Rubin, I guess it's been 2.5 years now, she had a study where we found that, in fact, you can look at her post down below through Facebook or on my website, marywong.life, where she discusses her study. And what you find is that there is an increase of live birth rates, which is way better than just pregnancy rates. So in her study, there was no real increase in pregnancy rates, but live birth rates. So who cares if you get pregnant, right? If you don't have a baby in the end. So what she's saying and seeing is that there's more take-home babies. So that's awesomely telling. So I would certainly do acupuncture. And in her study, it wasn't just acupuncture. It's lifestyle, dietary changes, herbal medicine, supplements, and they were individually specific. So meaning there wasn't a very specific protocol for each person. So unfortunately, it was not a randomized controlled trial. So to certain Western docs, they're like, no, this doesn't count. But we say, hey, this is in real time. This is not acupuncture in a vacuum. And no one's going to be in that place. So what's also interesting is the people that had the live birth rates that did acupuncture were, compared to the control that didn't do any acupuncture, they were the ones that were given the diagnosis, the worst of the worst diagnoses. So for example, the premature ovarian failure, that's definitely one of the biggest ones. So that's also telling, because if you're having a person that has a worse fertility prognosis than someone who has like a lighter diagnosis, and yet in the end the take-home baby was with the one that was diagnosed with the worst diagnosis, and acupuncture was part of it, then I'd say, hell yeah, let's do that, right? Don't you think? It's just a no-brainer. So that's out there. And since I guess about 1999, the Stenner Victorian was one of the first acupuncture studies on how it works out for increasing pregnancy rates. So that's more about the pre and post embryo transfer treatments. Meaning if you're doing IVF, this is IVF specific, if you do an acupuncture session before your embryo transfer and then right immediately after embryo transfer, it increases pregnancy rates. So since then, there have been like multitudes of tests. For most part, it does show the same, but there was one study that didn't. It was the opposite. And so when you look at limitations of acupuncture studies, there's a couple of things, a couple of criticisms that can account for differences. So, one of the Western criticisms is, well, it's not a sure thing because some studies are saying otherwise. So while we say all the studies that are out there, it's not homogeneous, meaning they're different. So if they're different, then you can't compare apples and oranges. It just doesn't work. So you can't just discount something because something is done differently. And the other piece to that is the one study that they're citing that, gee, acupuncture actually made things worse. It was, again, it was a pre and post transfer one, but the protocol was completely different. The acupuncture points were different. And to be quite honest, looking at it, it didn't even quite make sense because I wouldn't have used those points. And then thirdly, the location of where the acupuncture was off-site from the fertility clinic where they were doing the embryo transfer. That's not a problem, but it was way across town. So the problem was that people were driving across town in traffic, getting stressed. So it kind of decreased the ability for the acupuncture effect. Again, that's speculated. We don't know for sure, but there's a lot of good reasoning as to why it didn't work out so well. So my point to you is that, hey, don't look, what is that expression? When you look at studies, take it on its face value and don't look at it as a godsend and that it's like the end all be all. There's lots of criticisms with everything. So the one thing though, for sure, so we did say it did help in a lot of studies, and in clinical practice, that's what we see. Like I said, acupuncture is not done in a vacuum. It's done in real time, real life. But the other piece is, it's not just about pre and post embryo transfer treatments. It's also about looking and doing acupuncture for a good 3 months before. Let's say you do an IUI or an IVF. That would be the most optimal, because the development of an egg, your follicles, are more than just that 14 days that they're banking on, that you're doing drug protocol, for example. It actually, and that's your antral follicle. We want to help it at its pre-antral follicle stage, which is, just as it's starting to germinate out. Because kind of like, and we have an expression in Chinese medicine where if you cultivate the soil before you plant the seed, you can have a blossoming, blooming plant, right? So here, if we cultivate that soil, feed it, nurture it, give it water, give it awesome nutrition, lots of extra blood flow, oxygenation, all that, then potentially you have a higher energy egg cell that can become a healthier embryo eventually after it gets fertilized. So that. What else do I need to say about this? The thing is, the truth is acupuncture is growing as a profession. Lots of women are seeking this out, and not just for IVF. And, for those of you that are not in that place of doing fertility work, acupuncture is really great for a host of many things. So any pain issues, for example, that's the number one. Digestive issues, insomnia, mental, emotional. There's so many things that it can help. So I do urge you, because we certainly witness it. Because I'll tell you, and as I tell other patients, listen, I've been doing this for 25 years. If I did not see time and time again, or patients repeatedly feeling better and having more optimal health, listen, I would not stay in this field. I would feel bad. I would feel guilty. And thankfully, I see great outcome. I never say that I can cure, because I don't actually believe in that word. I believe that we can optimize and help in healing. And healing comes from within. We just tap into that vessel. So that's where I stand on it personally. So let's see. I talked about limitations. All right, very specifically, and I'll read this right off the bat. Acupuncture is a holistic approach, does not follow the strict principles of a specific diagnosis and targeted treatment. So really it takes into consideration the various aspects of lifestyle, the effect of disease or challenges each individual has. So you can't do the exact same protocol for everyone. And that's what research really wants you to do. They want to give you a specific protocol. And I'll tell you, for those who've done IVF, and me personally, I've done a whack of different IVFs, and it's not protocol based. They start with the same kind of thing, but every single IVF I had, they did a different drug protocol. And so you can't just do the exact same for everybody. So if you're discounting acupuncture, then you might as well discount everything else that you're doing, really, because there's no one way of doing anything. Okay. Oh, right. The last thing, sham acupuncture. So sham means fake acupuncture. So if you're trying to test acupuncture, where it's like double blinded, which you can't, because how can you pretend to do acupuncture with someone? So they had to figure out a protocol that was called sham acupuncture. But what we know now, having done lots of different kinds of types of sham acupuncture is not inert. It means it is still active. It can still have an effect on patients. So it's really not a great way to test, which again makes studies and the how to study acupuncture very difficult. Does that make sense? Okay. Right, last thing, I mentioned about how acupuncture is being, I know, last week I had to address some very stern physicians because they're like, well, I'm hesitant about acupuncture because it's not, what is it? What did they say? It's not conclusive that acupuncture is a done deal in terms of helping fertility. Well, guess what? Neither is IVF, neither is IUI, but they're all still doing it. And one case in point is this study that I pulled out, 1963, where they used clomiphene citrate, which is Clomid, that you would recognize as. And the first study that they did was with 7 people, and only 4 women were given Clomid. And it was insane. So they knew that Clomid had an effect on estrogen production, and they just didn't know where it was acting on. And in this study, they were testing 2 drugs. One is called MER25, which they completely pulled off because people were having crazy hallucinogenic side effects. So they pulled that off, and they did that on 3 women, so poor women. But the 4 women that they also did Clomid on was the protocol was insane as well, because right now, for fertility purposes, women are on it from, let's say, like day 4 to 7. So 5 days, they're on it. In this study, 1963, the first woman, 59 days. Can you imagine? So she became so cystic, no ovulation, and then she ended up having crazy profuse bleeding, so they had to stop it. That didn't stop doctors from utilizing it. Of course, they've changed the protocol, thank goodness. But the point is that we should not reject things that we're not 100% sure of, because in Western medicine, they're continuously doing that. And in fact, again, you going through a fertility clinic, you are a science experiment every single time, because we don't know how you're going to react. They don't know how you're going to react. And they only know after they do it once or twice or 3 times. And then they change the protocol. So acupuncture has been around for over 3,000 years. There's a lot more experience behind it. Hence, we call it the longest ongoing experiential science, because they're through experience, time and time again, they look at people's reactions to acupuncture, and they'll change points. And they've been doing that for thousands of years. So it's a really, it's got such wisdom in it. It's not a new science. It's really old. There's lots of wisdom. So you can trust it. And certainly there are no ill effects. So it's very safe. So I guess the one thing is, the worst case scenario, it's not going to do it for you. But the best case scenario is you feel a hell of a lot better, which 99.9% of our patients say and claim. And did you get a baby out of it? Hello. It's a no-brainer, right? I'm going to actually tell you guys what one of my patients said. When I did this webinar last week for the fertility docs across Canada, I thought, hey, it shouldn't just be about me speaking of my experiences with my patients or my personal perspective as a patient. I thought, why don't we hear from our patients? So I got over 50 patients very quickly and did a quick survey, and this is what we got. So it's like, how do you think you benefit? And what's missing at the fertility clinic? I don't need to go into that, but I just thought this was really cool. So if you've never done acupuncture, maybe this might be something nice to hear. So this is a patient of mine. And if you're watching, awesome. I'm reading it out to everybody. Okay. I was seeking much needed stress relief a few years ago after going through a divorce, trying to reboot my life while dealing with health issues and then experiencing my own struggles with infertility. The accumulated stress caused me headaches and shoulder pains that also affected my sleep at night, which caused me to be more irritable the next day. Sound familiar? I don't think that's that uncommon. I was a first-time user looking to optimize for fertility after a failed IVF attempt. After a few sessions, I realized that acupuncture wasn't just about getting needles stuck in my body for an hour and hoping for a miracle to happen. The whole experience helped me relieve my stress, rebalance my mood, calm and relax my mind and body so that I can focus on healing and embracing life again and focus on myself and my well-being. That helped change my mood and outlook on things. So I'll say it to you. I mean, yes, we see lots of people that fall pregnant while they're doing acupuncture, but ultimately, and if there are practitioners that are watching, our job is not really just to get a baby in your belly. It's really about being by your side in this moment, because from here to here, there could be some space of time. For some, it's only, a couple of months. For some, literally, their fertility journeys is years long. So what do you do in between? How do you keep sane? How do you feel whole and well, right? Acupuncture can help that. Lifestyle and dietary changes can do that to a degree. But, that we can have a conversation about later. Okay, last bit. The other thing, just the Hippocrates Post, which is an online blog for lots of fertility docs. This came out March 2018. And literally last week, Dr. Magarelli emailed me this, and I thought this was so cool. So this is a IVF doctor, the director of IVF Cube in Prague, Czech Republic. And she found that the patients that did acupuncture had a higher pregnancy rate. Well, we know that as acupuncturists. Anyway, she saw that, awesome. But then the question is, is it placebo? What's going on? But I thought this was eloquent because, so against this emotionally charged backdrop, meaning trying to conceive, is it not wise to always strive to tip the balance in your favor, even when the methods employed might be deemed controversial? So i.e., acupuncture under research terms is deemed controversial just because it is not 100% in terms of guaranteeing increasing fertility rates. Well, again, as we know, neither is anything you do when it comes to fertility, not at the fertility clinics, not anywhere. So to her perspective, she's saying, hey, if it helps you, why the heck not? And certainly if you feel better about yourself, why the heck not? You've got nothing to lose. And ultimately, from a Western standpoint to an Eastern standpoint, we're coming at it from different angles with different tools, but ultimately we have the same purpose. We want to make a difference in your lives, and we really hope to have a baby in there, but we don't know. So we do the best we can. And you do the best you can. So here we are. And that's the conclusion of my talk. And so hopefully you'll get lots out of it. And again, check out my other ones below. That's not bad, just below. Or visit my website, marywong.life. And there's lots of tidbits in my book, Pathways to Pregnancy. Go check that out on any online venue where you can buy a book. And also, in a couple of weeks, I'll be announcing, it'll be very soon, where we'll do a highly affordable monthly program where you get to spend time with me and ask me direct questions directly in privacy in the small group. And so it's like getting a session with me and consultation with me, but in a group form, so that it's really affordable, because I know there's lots of people with questions out there, and yet they don't want to raise their hand because on Facebook it is public. So this way it's private. You get me all to yourselves, and maybe also create a community so that you guys can communicate with each other, and I'll be teaching on different aspects. Okay, so thank you for watching. I'll look forward to being with you next week, 8 p.m. Eastern Standard Time. Be here, be square, and I'll talk to you soon. Take care. Have a great, awesome day. Bye for now.